Hey guys, welcome back to my channel and thank you so much for coming back. For those of you who are new here, hi, welcome, hello. My name is Princess. I'm a midwife and I'm also a mother. On this channel, we talk about everything pregnancy, motherhood, parenting, delivery, baby, and everything in between. So if you are new here, please don't forget to subscribe to my channel and also don't hesitate to comment, like, and share. I'll be so grateful. More specifically, let me know what kind of videos you want me to talk about in my subsequent videos. Thank you so much. So in today's video, we'll be discussing how to take care of your perineum or perineal hygiene, vulval hygiene in pregnancy. So under there, how do you make sure it's okay during pregnancy? How do you care for the place so that you don't get infections throughout the pregnancy? So do not go anywhere if you want to get all the juice that I have for you. Thank you. Okay, so welcome back guys. So as I said earlier, today we're going to be talking about how to make sure that your vulva and your perineum is doing all year throughout the pregnancy. So no vaginal odors, no vaginal itching throughout the pregnancy. Aren't you excited? Yes, I'm here to support you so that you maintain good personal hygiene or good perineal hygiene throughout this pregnancy. So usually I know a lot of women find it very difficult to talk to their doctors, to talk to their midwives when they have problems regarding their vagina and their vulva. Usually it's very easier for a woman, for a pregnant woman, for generally for any woman to walk into any consulting room of a doctor or a midwife to tell her or him that, oh, I have a headache, or I have abdominal pain, or I have leg cramps, or I have a waist pain, or like it's very easy, like they just go and then they just tell them. But usually when it gets to areas inside of the underwears, then it becomes hell. Women generally don't want to talk about it at all because they feel very embarrassed. Some women also feel like it's a no-go area, so they stay at home and they try different remedies, and then sometimes it worsens and sometimes they are good to go. But I am here to help you with some tips to make sure that your VGG is doing so well and you're not getting any infections as much as possible throughout this pregnancy. So I am sure by now, if you're pregnant, then you know that your vaginal secretion has increased. Yeah, it has. I know. Yes, and that is called leukorrhea. It is something that is normal with all. This increased vaginal discharge called leukorrhea is supposed to be clear. So whenever you have a vaginal discharge increased during pregnancy and then you realize that it itches or it has a different color or it has a bad odor, then know that it is not leukorrhea. It is a sign or it's a symptom of a problem or a condition, any STI or any genital tract infection, which may need your doctor. I also know that most women do not know the difference between their vagina and then their vulva. Sometimes they're talking about their vagina, but then they're talking about the entire vulva. Sometimes they also use it interchangeably. The vulva is actually different from the vagina. The vagina is that canal where that penetration during sexual intercourse usually happens there, and the vulva is any other part in that genital area. So you have your labia majora, your labia minora, and then you have your vestibule. It is where the vestibule is that usually you would find your vaginal canal or your vaginal opening. That is where you also have the urethra, where urine pass out from. So you urinate from a different place and you have sex from a different place. A lot of people know, a lot of people don't also know. So for those of you who do not know, I got you. If you know you have increased vaginal discharge during pregnancy, which happens to all pregnant women, then you have to do a couple of things to adjust. The first tip I would advise you to is to invest in a couple of panty liners. So you would need a lot of panty liners, so that whenever it becomes wet, you just take it out and replace it with a new one. It's very, very good, and then it would help you so much. The next thing you would have to also do is to make sure that you wear cotton panties. So wear cotton panties, no nylon panties during pregnancy. Just wear cotton panties, and preferably you wear white cotton panties. I actually educate or advise my clients that I encourage them to get white panties, because whenever your discharge changes in color, you may not be able to know, and the discharge that increases in pregnancy should be clear. So sometimes some people are having greenish discharges, other people are having yellowish discharges, other people are having milky discharges. So the only discharge that is normal during pregnancy is the clear discharge, clear vaginal discharge. So if you are getting a green, whatever color, it is not normal. How do you know it? If you are wearing a black panty, it will be very difficult for you to know. Or how do you know if you're wearing a green panty? Like, you wouldn't be able to get the difference in color earlier. So for me, I always advise my clients to go in for white cotton panties, so that they can be able to see all of the changes once they occur. I would also advise that you get underwears that are loose, because you don't need so much tight underwears around that area. You may need some breathing space to enhance with circulation around that area. You would also have to avoid douching, so do not insert anything inside of your vagina. Don't also insert your hands inside of your vagina when it's time for you to wash your vulva, or it's time for you to wash your vagina. Actually, when I was a little girl, I had one of my aunties tell me that as a lady, you always have to squat and make sure that you're inserting your hands. So meaning you have to have short nails so that you can insert your hand inside of your vagina and bring out all the dirt that is inside. And I grew up, and then I became a nurse, and I learned that it's such a bad practice. So I don't know how many of you do that. So if you do that, you would have to stop doing that. The vagina is self-cleansing, and it's a sterile area. Once you keep putting your hands inside there, then you are destroying your vaginal pH, which is going to put you at an increased risk for getting recurrent vaginal infections throughout your pregnancy. The next tip is also that whenever you pee or whenever you visit the toilet, you wipe from front to back. So if you do this, you are kind of wiping from a cleaner area to a dirty area. But if you don't do this and you wipe from back to front, then that means whatever is around your anal canal is kind of getting back into your vagina, and then the bacteria that are around your anus, when they get to the vagina, is going to cause some infections for you as well. So make sure that whenever you're wiping from front. Whenever you're wiping from front. You should also avoid any vaginal perfumes, scented wipes, and scented tampons, scented pads, whatever, scented panty liners, because they're also going to destroy your vaginal pH and put you at an increased risk for getting vaginal infections during pregnancy. And you should also make sure that you trim your pubic hair, or you get rid of pubic hair, so that the moisture that is being absorbed or whatever that is left around the vagina doesn't stay there for a very long period of time. And the vagina is also self-cleansing, as I said earlier. So whenever you are bathing, or you are taking a bath, you make sure that you wash your vulva, specifically the vestibule where you find the vagina, with just water, and don't go deep inside trying to insert your hand to bring any dirt there. We already advised you against that. But you can always wash your labia and then your groin area with mild soap. So you wash just the labia or the groin and those skin folds around that area with mild soap. But the vagina or the vestibule, you're just going to wash that area with plain water. If you're a person who also likes to swim, whenever you finish swimming, make sure that you're changing your swimming costume as early as possible, and then wiping yourself well, and then wearing a dry panty. Whenever you also finish bathing or whenever you take a shower, make sure that you are changing your panty. So you're not going to wear that dirty panty that you wore before you bathed. So you're wearing a new clean panty. Sorry, a clean panty that has been washed and then dried very well and possibly being ironed. So you're not going to wear a dirty underwear anymore. No, you're going to wear a very clean underwear after whenever you finish washing your panty or your underwear, make sure you are drying them in the sun. Or if you're drying it inside, make sure that you're drying it very well, and if possible, you kind of iron it to kill all of the bacteria or microorganisms that may be causing vaginal infections. Sometimes you may notice that the increased vaginal discharge is not clear, so it has changed in color, or it is offensive, or it is itchy. In this instance, please don't feel shy to talk to your doctor or to talk to your midwife, because it may be a sign of any vaginal infection, which ranges from yeast infection to a sexually transmitted infection. So talk to your doctor or your midwife, who may need you to come to see them to assess how the discharge is, and they may prescribe the right medication for you to treat this kind of vaginal discharge. Sometimes it can make your vagina very, very edematous, and make sure that you report early, because the earlier you report, the early that we get to treat it, and the better the prognosis, because some of these infections can go and affect the baby in utero, and I'm not sure you want to give birth to a baby who is unhealthy or who has certain conditions because you felt so shy or you felt so embarrassed to discuss with your midwife or your doctor when you had a sign or a symptom that you knew wasn't normal. Please let me know how these tips work. Thank you so much for watching. Let me know if you like videos like these, and also don't hesitate to comment, like, and share. I'll be so grateful. So until we meet again on my next one, have a good day. Woo!